Good morning, everyone. Thank you for joining us today. It's thank you to Dr. Chhavi for agreeing to do this talk. Everyone has not heard of anything else, I think, in the last few months except COVID. So we've had so much of uncertainty and fear in our minds. And we thought the best person to address these points would be Dr. Chhavi Mehra, who is a US trained physician with over 25 years experience. Dr. Chhavi Mehra is an internal medicine specialist, and has been doing extensive research on this pandemic. So I hand you over to Dr. Mehra, who would be addressing these points with us. Over to you, Dr. Mehra.
Hi. Can everybody hear me?
Yeah.
Yes, we can.
Yeah,
and clearly?
Yes.
Clear.
So I first and foremost want to thank all of you for taking out the time to join this and giving me a chance to be able to share not only about the virus, but what is very close to me is to how we all as a community accept, understand, and in a structured manner manage. I'm a physician. I'll repeat. I practiced for 25 years internal medicine, and 10 years of those were spent training and working in the Bay Area in California. And the last 15 years have seen me in Bangalore, a place where I always wanted to come back to. When I came to India 15 years back, my dreams were to make India more aware of prevention rather than disease. That's what I had learned in primary care. And I was very fortunate to find Dr. Sunita and Dr. Arjun at RxDx, and we joined hands. And since then, we have been doing fabulous community-based preventive pre-hospital medical care. Why do I talk about this today? Is because in these times of COVID, and I know you're all waiting to hear, and I have some things to share. Everybody has read everything, but now how to look at COVID as in the manner of prevention or pre-hospital care, how to make the tertiary hospitals, which are extremely precious at this time, the doctors that are in the hospitals, to give them a break and to try and manage COVID-19 as much as possible in a home care setting. Know about the disease, understand, accept, know that the doctors are very well equipped after about 4 months of knowing this pandemic, and how we all together work with safety and prevention. So I'm going to share my screen with everybody. So basically 4 months into the declaration of COVID-19 as a pandemic, and I'm talking about the entire medical fraternity, we all understand this virus much, much better, its management and how to prevent it. We've understood pathophysiology of the COVID virus, and we understand the disease better. And the outlook to us as a medical fraternity does look more positive and optimistic at this point. I also have felt, and I'm sure you all feel it, that as a physician who believes in prevention and a physician who really feels that there is a lot of fear and mental trauma and stress from COVID in society, with sensational journalism not helping also, I feel my contribution to society would be to educate, make people understand, and know that up to a certain point, they all have control. Their doctors know what they're doing. Their primary care facilities know what they're doing. Their tertiary care hospitals know what they're doing, and everything will be okay. So the goals of my webinar is to share realistic information, the physiology, the test, the treatment to prevent COVID, to touch upon all the scientific fraternity and what they have achieved in the last 5 months. And then finally, to really thank all of you engineers, technologists, bioengineers, data analysts out there, because I know that what we have as doctors, as a medical fraternity, 4 months down the line goes all credit to all of the background work that you guys have put in there. We have all the information. We can deduce all of our treatment management plans, and my sincere thanks to these unsung heroes at this point. So now, yeah, well, I call it good news because the death rate's low. So the total confirmed cases, of course, are at this point more than 12 million. The case fatality rate continues to lower down 4.5%. And there was the largest death on a single day was April 17th of 12,000. And in the last 2 weeks, an average between 3,500 to 5,000, let's say 4,500 deaths on a day around the world. But then if you look at these curves that are going on, hoping that this flatness continues, we will have peaks. I'm not saying we won't, but in general, we do see a bit of flattening. I know America at this time is going through a current spike again, but in the last 3 months, we have seen things flattening. Statistics, a quick overview. I just went over the world statistics. India is now 8,30,000 plus cases, but the recovered cases are quite high, which is 5 lakh plus. Active cases about 2,84,000, and our case fatality rate is 2.6% in India. In Karnataka, right now we're going through a peak and a very high time with COVID. 33,418. I did this talk about 7 days back, and the numbers were so astoundingly low. So we've really grown. Recovered 13,000, but active 19,000 plus. And our case fatality rate in Karnataka is 1.6. I just wanted to bring this picture. I don't know if all of you can see it, but it sort of historically tells you of all the pandemics and epidemics that the humanity has been bearing over the past centuries. And if you look, you know, the number of lives that each of them consumed, and if you look at smallpox, you know, and it was about 55 million. 17th century Great Plague, 3 million, 18th century Great Plague again, 600K. And the size of these represent the intensity or the death rate, you know, fatality rate that's caused by each of these infections. Then there was cholera, then there was yellow fever, HIV, AIDS, 25 to 35 million to date. And you know, this is not an exact number because this was prepared somewhere in April, but you know, if you look at it, 5.5, 5,50,000 is something where the corona death rate around the world is. We all know what COVID-19 is. I don't know if I should even spend time in this, but we know it's a large family of coronaviruses, and it causes common cold, and it also caused the Middle Eastern respiratory virus syndrome and the severe acute respiratory syndrome of Southeast Asia. And it is the COVID-19 specifically is slightly different from all of them. The human beings are not familiar with that, and that is why our body finds it hard to cope and fight it. So I just thought I'll quickly go over a simple part of community risk factor reductions, and what are the risk factors and what is a close contact, so that everybody has this very clear in their mind. And you know, if they meet somebody for less than 5 minutes and they are wearing a mask and the other person didn't, calling themselves close contact. Of course, travel history still in a community spread from here and there everywhere would make you more susceptible, because you might be traveling in a local train or a flight where other people are there. So that always stands important. But what is a close contact? Close contact is when you are within 6 feet or 2 meters of someone who's had COVID-19 for more than 15 minutes, or you're being coughed or sneezed on by an infected person. When either person is without a mask, if either or both are wearing a mask, it is actually not considered a close contact. The modes by which this virus infects is respiratory droplets, and these are released when someone coughs, sneezes, or talks, and these can be inhaled or land in your mouth or nose of a person who's unmasked. But he's unmasked. course, surface spread, CDC has lowered the risk of infection, but it continues to be there. Fomites and surface spread cannot be completely, ignored at this time. So surface spread continues to be there. That's why sanitization and disinfection continues to be a part of a very important part of COVID care. Just wanted to bring some data into this. To successfully infect a person, the virus needs a dose of 1,000 virus particles around that gets into them. And a typical environmental spread of activities, breath has 20 virus particles per minute. Speaking is 200 virus particles per minute. Cough, 200 million viral particles per minute, and then they can stay hours in a poorly ventilated indoor area. Sneezing, 200 million again viral particles. So just keeping you, the practicality of spread in mind. Usually, these are important. The scenarios and the bottom line criteria is: are you indoor versus outdoor? Are you in an indoor narrow versus large spaces? Are they ventilated or poorly ventilated or not ventilated? Is the density of people where you are high or low, or is the exposure longer versus brief? Low risk contact would be talking to someone with mask on the face-to-face, less than 10 minutes. Being in vicinity of someone more than 6 feet apart, less than 45 minutes. Walking, cycling, jogging by you in outdoors is low risk. If a gardener is working in your yard, does not come indoors and does not, you don't give them a drink by their hands or share any surface contacts, they're safe. Labor working outdoors should be fine, as long as, again, the same rules apply. Grocery shopping comes under medium risk, but can be made low risk by limiting time and hygiene awareness. Restaurants can become high risk if surface touch awareness is lost. High risk to very high risk workplaces, schools, even with social distancing through the surface transfer, are not considered low risk. Are considered high risk, and they become high risk with all the exposure, even with distancing. So high risk is HR. Arenas, concerts, cinemas, parties, weddings, public bathrooms, business conferences, all indoors, poor ventilation, huge density of people, all of them make you high risk. And these findings continue to be emerging, and they have been emerging for a while, and people have to manage each situation in the best possible manner. And it's time to reduce panic of surface transmission, but we need to be careful with sanitization, disinfection. I have a later part of my talk talks about that, but I still feel going back to school and work should be avoided. So this was on 9th of July, a briefing by WHO on the transmission of SARS-CoV-2. I put this here, it's very detailed because I want you to go look for it, and this is also a link for that. And do read up on it. It is a detailed, wonderful document. I do have a couple of key points of briefing from that, which actually basically has what I've already sort of sorted for you in the various scenarios that I was talking about. But this document that was released on the 9th is available, and please do go over it. And it says that, again, airborne transmission, respiratory droplets. They talk about aerosols, which are fine sprays that when we are in an environment, especially the medical fraternity is exposed to aerosols, which are somebody sneezing, coughing, and fine microparticles in the air. Respiratory droplets are larger, but they can also fall on surfaces, creating fomites and contaminated surfaces. So I think I'm not going to go deeper into this, but if you want to reach out, I'm sure my staff would be able to, point this to you or give you the link of this article. Again, the same WHO briefing, which was on 9th of July, and this also puts on how to prevent transmission, and it says identify suspects as quickly as possible, test, isolate all cases in appropriate homes or facilities, quarantine all close contacts of infected people, test those who develop symptoms. So remember, people who are close contacts do not need to test if they do not develop symptoms. So it is always important to understand and read these guidelines, and they all mean quarantine the close contacts and test those who develop symptoms. Okay, but they should be isolated, and they should be a particular time, which I'll again go over. Using fabric masks in specific situations, for example, in public places where there is community transmission and where other preventive measures such as physical distancing are not possible, is a must. A double-layered cotton mask worn quite tight with no pockets of air releasing all over your face are pretty good. Use of contact and droplet precautions by health workers, caring for suspected and confirmed COVID-19 patients, continuous use of a medical mask by health worker and caregivers in all clinical situations, at all times practicing frequent hand hygiene, and you know, I always keep this with me if you can see it, and you guys should always carry sanitizer along with you, and frequently at all times practicing hand hygiene, physical distancing, respiratory etiquette where you cough into your sleeve, avoid crowded places, do not be in close contact settings, do not be indoors in poor ventilations, overcrowded spaces. I mean, we can say this 100 times, but it continues to be one of the most important part of this COVID fight by humanity. The clinical presentations of COVID. So the common signs and symptoms are fever, which is can be low grade to high grade. And I just made this table here where it's common cold, flu, and allergies, because there are so many questions that get asked on, oh, is this that? And if you look at the COVID-19, which is in red, it's clearly dry cough, shortness of breath, and runny nose. Some people present with GI symptoms of diarrhea. Body aches and pains are same in everything. Sore throat are the same mostly. Headaches are same, but here the dry cough, shortness of breath could be GI symptoms, and sometimes loss of sense of smell and sense of taste, which comes with the smell, is an important part of COVID. These symptoms can appear 2 to 14 days after exposure, and which is the incubation period for this virus. And most people, 97%, we have enough data now in the last 7 months of us knowing this virus, that is a mild to moderate respiratory illness, and people recover without requiring special treatment. This is very important to understand. And who is at high risk is very important to understand. Anybody above the age of 65, anybody who lives in nursing home or long-term care facilities, anybody with underlying medical conditions and comorbidities which are out of control. Controlled comorbidities can be very well managed, even if a person was COVID positive at home. Uncontrolled means when your sugars are out of control, when your blood pressure is not in control, when your asthma is not in control, when people have had a transplant, are on immunosuppressants, if they are on steroid medications for any reasons where they might have arthritis or autoimmune conditions. These are, and people with chronic kidney diseases on dialysis. We have to watch out for all these people in our lives or around us and take care of them in the COVID times. When do you seek medical help? Now, this is a very important point of my lecture, because I really believe that at this point where I'm in Karnataka, where there is a huge spike going on, we've learned our lessons from Mumbai and we've learned our lessons from Delhi. And what we have found really is that staying at home after a proper evaluation by your doctor and having a doctor follow you through your illness till they are able to discharge you and say you might be COVID free is one of the best way to heal from COVID. Now, I will repeat, only after a proper evaluation by your physician, you can be considered, should this be a home manageable condition versus should you need to be admitted. As we all know that the hospitals around our country are overburdened. The tertiary care hospitals and the doctors there are overburdened. So as primary care doctor and belonging to a facility that completely believes in community care and has been standing there for the neighborhoods for the last 13 years that we have worked, I request all of you to tell your friends or anybody who is COVID positive or a close contact or have influenza-like illness to make sure they get evaluated by a physician and consider the outpatient care packages that everybody has designed with a lot of care to keep you safe and manage your condition. Going to a hospital is mentally and physically exhausting, and mental part is a very important part. The social isolation within a hospital and seeing sickness. I think as long as people can be managed by expert medical advice at home, we all can fight COVID very well. So here you go. When to seek medical help? If you have COVID-19 symptoms, as we talked, fever, body aches, shortness of breath, dry cough, breathlessness, if you've been in contact with someone recently who has it, contact your medical care provider, your primary care, and talk to them. Tell your healthcare team about your symptoms and a possible exposure I don't think you need to go for an appointment. Telemedicine has been a boon, and we can actually analyze patients completely. And I'm myself managing a few patients throughout their COVID journey from day 1 diagnosis to day 14 through telemedicine. I have discharged a few already, some being out of town. Let your doctor know if you have any other chronic medical conditions, any medicines that you take, any allergies that you have. I think giving all your proper information to your doctor is very helpful to us. Saying all of that, emergency sign and symptoms of this is for people, if you're taking care of somebody at home and you see these signs and symptoms, these people, this is called emergency. And emergency means taking them right away to a tertiary care hospital close by to you. Trouble breathing, persistent chest pain or pressure, inability to stay awake. They're extremely somnolent. They want to sleep all the time. They are confused, unable to tell you the time of the day, ask them, or the day of the week. So that means there is some confusion hanging up there. Or if they start having blue lips, blue face, or some bruising, these are all signs that require a person to be taken to a hospital and given care at that point. I will go on to testing at this point. So there are 3 types of testings that you guys are reading all about, and I'll just make it simple and explain them to you. RT-PCR, and then the antigen test, which is the Karnataka has just approved on July 7th to be done in Karnataka, has been happening in Delhi, and I'm sure in Korea it started off, in Europe, US. I'm still not hearing if antigen tests are taking off because they continue to work with the RT-PCR, and the appointments line currently in the US for these RT-PCRs are 2 to 3 weeks. Antibody tests are again to find out if we've had an infection in the past. RT-PCR, it's a molecular diagnostic testing technique, and what it does is basically it detects the genetic material from the virus, and it's an RNA virus. We take that and then we replicate it by reverse transcriptase into multiple copies of DNA. So the probability of seeing the virus, it's like, basically just zooming the virus into a larger form by one single RNA replicated into multiple DNA, and then checking it and looking at it and diagnosing it. It is the most sensitive and specific test available to us. Does have its limitations if you do it too early, but once symptoms come and you're symptomatic, at any time this test has a very high sensitivity of being truly positive, and if negative, truly negative. So still stays the gold standard for diagnosis of it is done in this manner. As you see the picture, we take a swab from the back of your nose, and through your mouth. So a nasopharyngeal and a pharyngeal swabs are taken, and then they are sent. The turnaround time, I think this was 10 days back, but now it's about 24 to 48 hours, because we also are in Bangalore overloaded with the cases that we have. The pricing for this test is between 4,500 to 7,000. The government did keep a cap of 4,500, which RxDx of course honors, but various places for whatever reasons do have increased their pricing for this test. Antigen-based COVID assay. Now, this is something which I am very excited about, and so is the medical fraternity. It is the latest FDA authorization, and Indian Council of Medical Research has also authorized antigen test as a new type of diagnostic test for rapid detection. This test is actually, again, antigens are always something that come from the virus. It could be that viral RNA genetic material, or it could be the proteinaceous parts of the virus, of the capsule, but it's a part of the virus. It comes from the outside. It has to be caught in by a swab. So you take a swab and you basically take a swab from the nasopharyngeal area, and you take a viral media and you put the swab in it. Immediately that virus is inactivated, because in this test, we do not replicate the genetic material and make it into a DNA. We actually take the protein on the capsule, and there is a cartridge which actually has a reactant in it to the protein which is on the virus capsules. We take a few drops of this viral media in which the swab was dipped, and we drop it on the cartridge, and you get it a positive or a negative. It is 100% truly positive. So it's a 100% specific test. What is negative? It is not a 100% sensitive test, which means that it can miss some tests. So if you are symptomatic and you do this test and you get a negative, I cannot give you a clearance. I will ask you to do a RT-PCR again in a day or two. But if you are positive on that day that I test you, you are 100% positive. So it's a 100% specific test, but there is a lack of sensitivity. Why? Because here we're not zooming the virus. We're not replicating that RNA into multiple DNA and making multiple copies. Here we're using a proteinaceous material. So if you had a light viral growth, I can only get that much proteinaceous material, and that is why the sensitivity will be a little less. It's a very useful test, has shown a great promise. Turnaround time is 30 minutes, has a very low risk to the person who does the test for you, because the minute you put it in the viral media, it is inactivated. The turnaround time I said is 30 minutes, and the cost is always most probably less than 1,000 rupees. Don't hold me to it, but it's a much, much cheaper test than RT-PCR. We have ordered it here at RxDx, and hopefully by early next week we will be doing this. They are much cheaper, and yeah, we have government permission to do it. Antibody test, again, has been in talk for a very, very long time, much, much longer than antigen, and a valuable test. Would not say it for diagnosis, but a valuable test for surveillance, because here it is what you're checking, something that the host that keeps the virus creates and to fight that virus. So it's something that is coming from a host. It has to be checked in the blood. Okay, so because we have fought for the virus, it's an antibody that our body makes to fight an infection. You take a drop of the blood and you put it on that cartridge. If it's positive IgG, then it is you had the infection in the past. The shelf life of these cartridges and these tests is very less. It's 3 days. They're highly sensitive and highly specific, but the shelf life and temperature sensitivity of these cartridges is very high. I sincerely feel that these tests would be very good for post-exposure and to see if your IgG levels are still there. Surveillance, you can surveil a population to see if they were infected in the past. But I would not recommend this to know if you have an active infection. Turnaround time again is 30 minutes, and the cost is extremely low, below 650. Again, again, don't hold me to it, but something like that. So that was about COVID testing. All that we know till date and all that we have available, all three of those tests are licensed by the Karnataka. So I know, and I'm very thankful for everybody around the globe that has joined in, but I do have to talk about the local, relevance of COVID right now. So yes, Karnataka and Bangalore allows us to do all three of these tests. Management and all that we know as doctors. This is a great time. I mean, I always like to thank our government of India that put in such strong lockdowns initially, because we all know our country's healthcare system, and we all know how difficult it would be if we did not even have the wonderful medical management guidelines that we have now. And at a certain point, we are so much better prepared to deal with COVID than we would have been in March. I will be eternally I will always be grateful to our government to have those strict lockdowns for the initial time periods that we could get information from the Western world and adapt ways to help the very crumbled Indian government health system and to be able to make the population in some way, deal with COVID. So I always want to say that 90% of positive patients will be well managed at home and will recover 100%. Less than 10% will require hospitalization, and less than 3% will require ICU. So remember these figures, draw strength from these figures, talk to your doctors, and get care. From the day of the positive result, you can connect with various programs around that are offering daily doctor consultation, telenursing, all through tele-manage you through the things, teleconsults every other day with your doctor, every day, whatever way you want it, and get your suggestions, reassurances, treatment, and anything that is needed for healing. There are programs that offer you diet counseling during these days, a good physiotherapist and respiratory, because physiotherapists also are respiratory rehabbers. They can help you with your respiratory exercises if you need. Psychologists for mental strength. There are programs that we have worked very hard to devise, and I'm sure a lot of people will benefit from it. These are from RxDx, and you can get it from our call numbers. This is again what it tells you. We have these packages. We are taking care of already a number of patients are on these programs with us and are extremely happy and actually mentally very, very relaxed that they have these programs. Now, again, there's a list of things that I'm able to talk to you at this juncture of COVID on what can be done as a medical therapy for it, and I'm again in gratitude for all the scientists, for all the background bioengineers, everybody that we have come to this point that we can analyze and come to have multiple ways of structured management of COVID. So I'll go over the vitamins very quickly. We all know vitamin D is very important. It enhances pathogen fighting effects of monocytes and macrophages. The white blood cells are a very important part of your immune defense, decreases inflammation, and make sure you're on a dosage of at least 2,000 international units daily. Zinc is an essential mineral that your body does not make on its own. It aids your growth of cells. It causes DNA synthesis. It works with immune function. It helps in wound healing. It again helps in reducing inflammation. And remember, the word inflammation in COVID is extremely important because it is that cytokine storm and that inflammation that we are all trying to prevent. So any natural supplements that do that are very important in your daily diet. A doses of zinc between 20 to 50 milligrams. And actually right now with the heavy COVID in Bangalore, I'm actually prescribing everybody 50 milligrams daily. Vitamin C, again, a very well-known immune system, activator. It activates T lymphocytes and helps in production of interferon and has efficacy in reducing intensity of common colds. and in a dose of 1 gram to 3 grams daily is recommended at this time. HCQS, and I did put this ICMR here because so many controversies and very, very sad, the Western media, the data collections, the mess in data collections, the pulling out of very important studies because they were not supporting HCQS. But I am going to go with the Indian Council of Medical Research, and I am a believer in HCQS, and ICMR continues to say that. And there have been in vitro study at NIV, National Institute of Virology at Pune, showing efficacy of HCQS against viral activity. It reduces both the infectivity and viral RNA replication of SARS-CoV-2. The joint monitoring group and the national task force, they have recommended all asymptomatic healthcare workers involved in containment or otherwise treatment of COVID-19, or asymptomatic healthcare workers working in non-COVID hospitals or non-COVID areas should be taking prophylaxis of HCQS. Asymptomatic frontline workers, surveillance workers, household contacts of laboratory confirmed cases should be on HCQS prophylaxis. No one should take this medication without physician guidance. What is the role of antibiotics and antivirals? Antibiotics, we've heard a lot about azithromycin, and I feel I worry so much about medicine and antibiotics being dispensed in our country without any regulation, that we will have complete immunity to the wonderful antibiotic that azithromycin is. But azithromycin, if used together with HCQS, can cause some prolongations of waves on your ECG that can cause trouble. So azithromycin and both HCQ should never be used until you are in a physician's care. Antibiotics in general have some role in COVID management because with viral infections, our immunities are low, and we tend to also develop secondary bacterial infections. So it's not just azithromycin. Augmentin is also being utilized to lower the nasopharyngeal infections that we are seeing along with COVID. Antivirals, I think you guys all have heard about them, which is Tabinacur, which is Fabiflu in India, and remdesivir. Both have shown some benefits, and remdesivir continues to go strong. It is intravenously given. Fabiflu is orally given. We still need to collect more data out of the Indian subcontinent for me to support it. There are good data from Russia and with Tabinacur, but in India we're still very new to it. We are using it, and just to clarify for everybody, both these are available at least in all the metros in India and are being used currently. So please do not worry that they're not available, or are they available or not. So this is something that I loved, hijacking SARS-CoV-2. And I really believe that this group of drugs will make or change the course of this illness or its perception by society. JAK inhibitors in the management of COVID-19. So I'll just go over it. So in severely ill patient, moderate, I mean, people who are in ICU with oxygenation, let's say we start there, and they have a cytokine storm, which is basically hyperimmune activation in their body, and which causes a lot of inflammation within them, which leads to this hyperimmune activation and inflammation causes a lot of inflammation within our air passages and our lungs, and that leads them into the respiratory distress syndrome. So the angiotensin converting enzyme 2 transmembrane protein provides the pathway for SARS-CoV-2 to infect epithelial cells. The ACE2 is highly expressed in our lung alveolar epithelial cells. So that is why it reaches the lungs. Why? This is what explains why the lungs are particularly vulnerable to injury. ACE2 also exerts a natural protective effect against acute lung injury mediated by the renin-angiotensin system. And if you down-regulate it after virus entry, it contributes to the onset of acute ARDS. So these are the enzyme receptors which tend to cause and permit the SARS-CoV-2 to be affecting the lung epithelium. So these inhibitors basically, so what happens in patients in the ICU of COVID is that we find high serum levels of cytokines and chemokines. These could be, the names are all over, but the famous ones are IL-6 and IL-10 and GCSF, alpha tumor necrosis factors, and the Janus kinase inhibitors. They target the IL-6 and other cytokines, and in one, they restrain the excessive level of cytokine signaling. Okay, and they all over India in the medical fraternity and my friends in the various ICUs around the country. We have a multitude of success stories which you guys never hear that have come through by the utilization of these very promising agents, and they are available. Tocilizumab is available by Roche Pharma in India, and in Mumbai, the CD6 inhibitor, which is itolizumab, is useful. I was just reading yesterday that people with psoriasis also use one of these agents, and there is a trial coming out using that agent in India, which the results will be coming out very soon. Very promising, many recoveries due to the use of it. And as a doctor, I feel absolutely fabulous that we have this data available at this point. You must have all heard about very simple thing like a common steroid, dexamethasone, and a study from UK coming out, and India loves it, and we were using methylprednisolone IV in our ICUs after that study came out. But we now have approvals to use oral dexamethasone as a pill in people with moderate to severe. Again, moderate to severe cases, mostly after hospitalization. We try not to use them at home. The guidelines will still shift, and maybe by next week I will get a better guideline that I can probably start them from home, and I would love to do that. But as of now, it stands that when we send the patients to the hospital, we use these agents. Plasma therapy, people who recover from COVID-19, their blood carries neutralizing antibodies to the disease. Okay? And researchers hope, but now we are getting a lot of data from the Western world as well as India. ICMR has 452 people who they are giving the plasma and getting results. And this is at the stage of cytokine storm in the hospital, and it can be given to people with moderate to severe COVID-19 when they are not able to make the antibodies, but they can use antibodies from someone who's had that infection in the past. 400 ml of plasma, not 800 in India. And I was talking to the doctor who's doing this main plasma work in Max yesterday, and I was asking as to how much ml of blood we collect in India. It is 400 ml of blood, and it goes through various processes. The blood is cleaned and the plasma is separated, and at the right time is injected. That is, I recommend people to read more about it. And if you or your loved ones have had COVID, offer to donate that 400 ml of your blood. It will go a long way in saving someone's life. There are two websites I've put in here, plasmadonor.in and needplasma.in. Both are India-based, and both will take you to a point where you can register to donate your plasma. Vaccinations, there is a huge list here, and I don't know what to say. I mean, just focus on the phase 2, 3 and phase 2 trials. And, as doctors, we get so much information. Last 2 weeks, we've been hearing that giving a live viral vaccine of measles might help your immune system to be boosted. So a lot of people are taking MMR vaccines. I think it is pretty benign taking that vaccine, except in certain situations of interstitial nephritis and all that you need to keep an eye, and I always do it with the help of a physician. But there is no documented or proven safety. I can just say that when we take a vaccine with live attenuated virus, our immune system does act up a bit and might help generating antibodies for the others too. Not supporting anything, just explaining to you where that last 2 weeks of MMR has been going. And that is where the BCG came up also, that did people who had BCG had lingering antibodies hanging around, which might help. Not proven yet 100%. India has quite a few cases and we've had our BCG. So we don't know. We will, Moderna seems the most current, and I will keep my fingers crossed, and I'm very positive person. By the end of the year, hopefully we have the first vaccine, and then March onwards next year, a few more promises. Keep your fingers crossed. And these are the amount of vaccines, and there are more that have added to this list that have been working on. My favorite topic, and you all know me if I've been your physician, that I myself am always taking the kala or the natural stuff, and I totally believe in naturopathy as an adjunct to good medical advice. So please, reduction in free radicals is very well known to prevent viral infections, and our Indian kitchens are full of healing spices and herbs. Go, good on ginger, tulsi, saffron, turmeric, amla, whatever you feel that you can get out of your kitchen, and make a drink or a herbal tea and warm liquids and enjoy them in whichever form that you need to do daily. Your diet should be rich in fruits, vegetables, nuts, vitamin C, zinc, omega-3, 6, rich complex carbohydrates, and so I also wanted to talk about yoga, which I don't know where my slide is, but yoga, and please make sure that you practice your breathing, your lungs. So if you can do a good Om Ucharan 3 times a day at 10 to 11 times, you will increase your lung capacity. Do Anuloma Viloma for a cycle of 10. Do gentle Surya Namaskar, few rounds every day. Stretch your body, and if possible, meditate. I think we've all known that meditation increases the length of your telomere in your chromosome. It helps you heal. So sit and meditate. Mental health awareness in COVID fine. We all know anxiety, stress, they cause high levels of cortisol in our bodies. What does the cortisol do? It suppresses the levels of happy hormones in our brain, which is serotonin and dopamine. And sometimes this can precipitate into frank depression. Be aware of people around you. May it be family, may it be co-workers, may it be neighbors, may anybody, your employees. Just keep an eye on them, their moods, their perception, their stress. Educate, create awareness. My whole warriorship during this COVID times is to reduce fear mongering and to be realistic, to be acceptant, to be understanding, to know that we are equipped at this time to be able to deal with this virus. And if we all keep a focus on that, we all will come out of this very well. Sometimes the levels of these happy hormones go way down, and sometimes we need medication to help us, and or we need at any time reaching out for counseling is a very good source. RxDx has online counseling. Please reach out. We also offer free online counseling for all our medical interns, junior residents who are sitting in those tertiary hospitals, have been put in as frontline warriors by all their seniors. They are going through a very, very, very hard battle, and from RxDx, this is a small gesture where we would provide them free psychological counseling and hold their hand through the difficult time that they are going through. Okay, so yoga and COVID comes now, and basically just what I said. Okay, so I come to the last part of my talk, which is prevention. And so stay home when sick. Please inform your supervisor, whoever that is. Be aware of any contacts in your families that you might have had. Make sure that you have any symptom of fever, cough, shortness of breath, body ache, call, do not come. You will save a lot of your staff. Physical distancing, we all know, skip non-essential trips in community, work from home, conduct meetings virtually, keep kids away from group settings, keep a distance of 6 feet. We all know how to wear. It should be completely covering your face. I have a N95 here that at home also I wear, and it covers, and I can accommodate it by my nose. So make sure that all the way down the chin and all around you're covered. So wearing a mask, do not touch it. Hold it by the hands and make sure you hold these together and keep that. Try not touching your mask by your hands and then touching your face. So, of course, namaste, waving, bowing. I know we all are aching for our hugs, but I guess we'll have to wait, and we'll have to just give all of this in the meantime. Travel with caution. Always avoid touching eyes, nose, mouth. Be very careful. Just don't touch. Your hands should be away from your face. Eat only well-cooked food. Do not spit in public. When you cough, always do it with an etiquette, cough etiquette, hands up. Clean your hands as often as you can. Wear your mask all the time. And if you are sick while you're traveling and you feel your fever coming up, tell the crew and seek medical care. Food handlers, cover face all the time. A shield would also be better. Hand sanitizing or washing your hands. They need to avoid, touching points, the doorbells, door handles. Encourage customers to place orders online or on telephone. Try to pay by Google Pay, guys, or Razor Pays or Phone Pays, or we are encouraging, and please, in Bangalore, I see that we're not paying anything by card or cash. We are doing everything touchless, contactless modes of payment. Our clinic does that all the time. Home quarantine, this is important. You could be a contact, you could have the disease and want to be at home under care, supervision of your doctor. I will underline that if you're COVID positive. Stay in a well-ventilated single room. Follow respiratory and hand hygiene. Maintain with masks on 1 meter distance from family members, and stay away from all elderly, pregnant women and children. Wear masks if you develop symptoms, or if you're caring for a suspect or a confirmed COVID-19 case, you can decide, I want to get tested. Avoid sharing any household items, and strictly avoid visitors at home. Wash your own dishes. I always tell people, if you are home quarantined, we actually, when people register for their COVID care packages at home, we have packages that we have designed where anything that they need, they could just tick mark and would be delivered to them. It could be anything from pulse oximeter, thermometer, gloves, sanitizers, respirometers, anything that you would, tissue boxes, anything that you would need in your room to quarantine. RxDx, in the packages we have these lists. You just have to put tick marks and send it, and our people will come contactlessly and deliver it for you. Sanitize your hands right away. Contactless home delivery of medicines from anywhere that you guys think that is the best way to leave it outside, and you could have a disinfectant solution that you could spray and then pick it up. We are, as a community initiative, from the very beginning, from I think 3rd to 5th of March, we have made sure that our pharmacies carry all that a community requires for safety. We have it available on stock, and it's available to you at any point. So please, go, if anything you need, this community neighborhood clinic is ready for you. Our lab drop staff comes with complete PPE with all aseptic precautions, and we have to take care of the community. The fear which we have learned can be avoided by taking utmost care of our employees, of our patients. And I think we've all designed this, and we are doing our best so that you guys, your people who have dengue, people who have bad UTIs, people who need home care, people who need home IVs don't have COVID. An uninterrupted home health care has been provided to everybody with utmost care and sanitization by RxDx. We are also now not telling people to come to the clinics for vaccination or immunization, because these are routine things. We will come to your house and immunize those kids that really need their immunization on time. So this is a couple of slides that I have. Again, cdc.gov and sanitizing your home and office. And it basically, remember, sodium hypochlorite comes out of a bleach. You know, those things that we use for chlorinating our swimming pools, and how when we go into the pools, the water smells of chlorine. It's very important. That smell is very, very important to know that this is a properly disinfected swimming pool. Similarly, in our environment, you can make your own solution, and you can use 5 tablespoons or 1/3 cup of bleach per gallon of room temperature water, and make these solutions and just spray it on your mouses or any surfaces that you might feel that might carry it, outside your home, and any place that you feel that requires surface cleaning, you can use this solution. I just wanted to bring 3 points out. Sanitization means both cleaning and disinfecting, but cleaning means you remove some germs, dirt, impurities, so the surface looks cleaner with soap or water. Cleaning does not necessarily kill germs, but lowers their number and risk of spread of infection. Disinfecting using chemicals, for example, bleach solution, does kill germs also. It does not necessarily clean a dry surface or remove, but removes germs, I think, so by killing them, and it can lower the risk significantly of spreading infection. Sanitization just means both of them together. This was a lovely slideshow I saw on how people should clean workspaces. So I come to the end of my presentation, and I always tell, and I know you've heard it 100 times, this too shall pass. But the keyword, and humanity will prevail, but the keyword here is humanity, and which according to me by definition includes compassion, sympathy, selflessness, and generosity. And we need understanding, education, structured action. And I hope with today's presentation, you all will be carrying a lot of hope and confidence, and that shall dispel the fears. And COVID-19 is not unknown to us anymore, and a medical fraternity knows a lot about it already. So, and I will continue to contribute to society by any talks or anywhere people would like me to talk and educate people. I'm always welcome, because I think this is the least that I can do because if people are mentally fearless, COVID's not coming anywhere to me. Thank you very much. I will take questions.
Dr. Chhavi, there are some questions on the chat line.
Okay, let me see. 1 second.
I can read them out to you if you prefer.
Okay.
The first question is, why don't we see the antigen test in more places?
Yeah. So the reason the antigen test is, there are 2 reasons for that. Each state government is giving us permissions, or they have to have guidelines for the use of antigen test, because that data actually is also very, very important. We will need to document and see the prevalence of this disease in society. So ICMR has to be involved. So they have to have their processes in place in a particular place that they will allow, or a state they will allow. Number 2, yes, there is also a dearth in the supply of the kits. I'm very sure in the next 2 weeks, we will have it around the country.
What is the sensitivity rate of throat and nasal swabs for the RT-PCR?
The sensitivity and the specificity actually is it's called a gold standard, though I will not call it 100%. I think the sensitivity of the RT-PCR, if done, it is according to duration. So if it is done between day 1 to 5 of you acquiring the infection, the sensitivities are around, close to 70-80% only. But if you do it from day 7 to day 12, the sensitivity of it goes to 97-98%. So it also depends upon what time that you catch that test and virus in you.
For asymptomatic patients, is monitoring with oximeter enough, or is an X-ray needed to check for lung infection? And do asymptomatic patients recover faster?
So I will really request all asymptomatic patients to not take this disease or treat this disease by their own self. Okay. First of all, asymptomatic, let's classify. Asymptomatic who've had the test and they're positive, or asymptomatic who don't know their status. So let me assume that this question was asked by somebody who's asymptomatic and has not tested. Okay. So anybody, so I don't know why they're calling themselves COVID, because if they have no symptoms and if they've not tested positive, then nothing is happening. But if they are a first degree contact of a family member that might have had a positive test, they are at a high risk. Okay. So these asymptomatic people should quarantine themselves along with their family member. They should meet their doctor at least once and get guidance on HCQS prophylaxis. They should, if they start developing symptoms, get themselves checked. And if their symptoms are worsening, they need to register for one of these packages where they are under medical care every single day till they are free of symptoms. I hope that answers the question of people who could be contacts but have not tested themselves. And asymptomatic people with COVID positive are people who should make sure that they are basically registered, I would recommend, under a plan where they do get to see a nurse or a doctor, go over their vital signs. It is very, very important, I feel, to be connected to your medical or healthcare provider in any time that you have ever been tested positive. Next.
The trademarks for trade names rather for vitamin D, zinc, and the vitamins.
Many. So many trade names. It comes the 2000 international. So vitamin D actually comes in India. So anybody who's listening in from the US, I'm talking about the Indian vitamin D. So we have many names for many doses, 1,000 units, 2,000 units, 5,000 units, and 10,000 units, and 60,000 units. And it comes under various names. I would rather somebody takes one tablet every day of the 2,000 units rather than a big dose once a week or once in 2 weeks. And I don't know the levels, how they are every day. But if you take a certain amount every day, I can say at least that you're getting a vitamin D every day. The name that comes to my mind, which I frequently use, is Ultra D3. There is also a D Must, and then there is also a D Rise. So, but Ultra D3 2000 is something that I prescribe.
And the zinc and the...
Zinc, Ascazin, ESCAZIN. It comes in a dose of 50 milligrams. It's available in India, and you can order from our pharmacy. It can be delivered one day. And Deepika?
And the vitamin C.
See? So vitamin C is Lim-C chewable. There are many natural vitamin C's. There is Selin, which is a solid. You just swallow it. There's something called Immune C. Dose is very important. Anywhere from 1 gram to 3 grams daily.
Will the Zincovit be good across all ages? And if not, what should the dosage by age group be?
Zincovit comes as a syrup, okay, for children, from age of, I think, 3 to 12. And then it comes as a drop when you are a baby, up to 3 years of age. And then it comes as a capsule, and it's across ages from the age of 13 onwards, okay? Zincovit has only 10 milligrams of zinc. And so I would recommend you, it's a great multivitamin. You can easily take that every day, and ask your pediatrician for the drops or the syrup ml that is needed for your children. But you can add for any adult safely 1 Ascozing daily along with Zincovit for an additional zinc coverage.
This is from Mr. Nirmal. I've always had slight variations in ECG and all checks have come out normal. Cardiologist has asked me to not worry as it's common and possibly due to very mild MVP as shown in the 2D echo. Is this a comorbidity, or if I am positive, can I be treated at home or do I have to be hospitalized?
This is a very stable situation, and it actually has not been considered a comorbidity. So you can safely be evaluated by the doctor who you take care from and kept at home for if you turn, hopefully not, positive.
Is it safe to order food from outside?
Hot cooked food should be okay, but I would say a no at this time, and cook at home whatever you can. But yes, the guidelines are that if the food is well cooked and is in a very clean container and you can sterile it, heat it up again and you can eat it. It should not have COVID.
Is it good to procure a pulse oximeter and keep it at home?
Absolutely.
Okay. If the virus is identified, who decides possibility of home quarantine? Is it the BBMP or self? And during home quarantine, what do we need to have at home, which you've already answered? And is there a possibility of repeat infection?
Yeah, very good question. So I'll go one at a time. So I just wanted to bring this out, and thank you for this question because people here are getting anxious. So let me tell you that when you get tested, there is a form that you fill, which is through your Aadhaar card, and you get your name and your address is captured in the ICMR data bank at that point that you're being tested. When your result comes back, the first report goes to ICMR, so they have it, and they inform your local BBMP that this person is. And now let me tell you that our government has done a great job, and I feel bad because people get terrified. Oh, the BBMP will come and they will cause a containment, and this, they are your friends. They are working day in and day out. They are trying to do the best with the limited resources available to them to prevent spread so that tomorrow one of your loved ones will not get affected. So the BBMP officer gets notified. The BBMP officer also will let the local duty government doctor also know, and your phone number is also captured on the phone. So suppose if somebody turns COVID positive, there will be a call coming from the BBMP officer to you, and please be very open to it. Please be very understanding that they are doing this to help you. They are not trying to make your life difficult. They are just trying to help the others around you. And I hope communities, people who live in communities tend to, get a little fearful and panic sometimes, but this is a very structured program. They will assess your living situation. They will see if you have good living situations where elderly and people who are immune compromised are not exposed to you, and they will be more than happy that you and you are under the care of a doctor, and they will be more than happy to let you stay at home in quarantine. And I already have explained the second part of your thing. Now, the third part, Deepika, was about,
is there a possibility of repeat infection?
So again, this question is still very young, and as of now, where WHO, CDC, and ICMR stand, the answer, I'm only going to repeat in one single word: no. And you can go out and read as much of those sensational journalism articles that keep suggesting that the IgG levels are falling and not sustaining. Studies have come out of China, there is reinfection. There is nothing at all in any academic, scientific literature which supports that there is a reinfection happening. IgE levels and their patterns are still emerging. I can safely say that you are protected for a few months for sure. When the RT-PCR for certain cases that came, there was a little uproar sometime back where the RT-PCR came back positive after 21 days. There are remnants of this virus that stay at a very low concentration in your system up to a month. But at that concentration, it can neither give you the disease back or infect somebody else. But the RT-PCR actually takes that one remnant and replicates into multiple DNA, and that is why it comes positive. But it does not mean that you are infected. Not a single person has reinfected anywhere. At least I have not read any scientific data on that.
Okay. And if we need to take treatment, can we choose where we want treatment from?
Absolutely.
Does
100%. 100%. They are very open to you. They might, if somebody requires hospitalization, that care, your primary care facility, whoever you're attached to, will have numbers of tertiary care hospital, your BBMP wards, and people who are responsible in that ward that can be called if you see somebody's pulse ox is going down or they are getting breathless and they need to go to the hospital. And the BBMP usually should be able to arrange a bed in their area. I'll give you an example for people who are in Whitefield. All the tertiary care hospitals in Whitefield have given a certain amount of their beds to the BBMP for COVID care. And people, it would be better if they came via the BBMP, and the BBMP person will be able to tell you which hospital has a bed available, and everything. But my thing that I would like to tell again to everybody and reiterate everybody is that let us try to work with the doctors early. Let us not try to manage this on ourselves. Let us work with our primary care so that we all stay out of hospital need. The more guidance and care we take it in an earlier form will keep you away from the hospital, and we will not overburden our healthcare system. This is my plea to everybody. Next.
We have about 55 questions, so we got a long list here.
What is the time?
Okay.
Okay, so we'll, yeah.
Yeah.
Deepika, you should have somebody look about these questions, and I'm sorry if I can't answer all 55, but we can try to take about 15 more and see,
Yeah. Can a 3-layer cloth mask be reused and with just regular soap?
Yes, wash and reuse. Next.
And what about the
Wash
N95?
The N95 can be disposed of after using for 1 day.
Okay. And what are the normal ranges in an oximeter if you're using that?
A normal range in an oximeter is up to between 90 to 100. But in COVID, the guidelines are that if you are above a 95, you're very safe. From 95 to 93, you might need to check more frequently. Under 93, you need to call your doctor. And under 90, you need to go to the hospital.
Can an antibody test be ordered from RxDx?
We still, as I told you, that the shelf life of those are less than 3 days, and they come in packages of 100 to 200. And we need to have 100 clients waiting for us the day we order those 100. So if people are ready to come in, we really have to collect 100 people before we order that package, because we have to finish it within 3 days. So as of yet, we haven't ordered because of the situation. We haven't had a demand of 100 people at a time. But if we get that demand, we will take care of it, especially for corporates, or it's easily available. We will do it instantly, but we need to have that much demand.
Can we use soap hand washing as good as alcohol hand sanitizer?
If washed properly for 2 minutes,
okay,
it is as safe. Using the proper techniques of hand wash.
Sorry. How do you clean and sanitize fruits and vegetables?
You just wash and soak them in soap water and wash them well. And those are the guidelines. There is no, I'm seeing all these ads of putting them in UV lights and sanitizing them. A good wash with soapy water and then plain water is enough.
What about bread and snacks from outside? I know you said cooking hot food. Can they order packaged?
Bread can be roasted up to a good temperature and had. Heat will kill the virus.
The recommended dosage for 5-year-olds of the Z, C, and D. I think that you said come and drop in.
I didn't get.
What is the dosage of the different vitamins for kids of 5 years?
I think I would let you ask your pediatrician. I'm sorry. I'm a physician. Go ahead.
Is RxDx collaborating with the apartment associations for managing in-house CCCs, that is the COVID care centers?
We have been working very hard to work with our communities at various levels. We have been working day and night to create for you guys COVID packages so that we could be available to you from a distance. Now, apartments and communities are approaching us to have something within their centers, and our entire team is right now in the last 2 days has been working, and yes, we should be on board with them in the next few days with our plan and our, we have to just make sure manpower and we have everything available to be able to support their needs. Yes, but we do want to do whatever we can so that you guys feel safe and taken care of.
And if we have any one of the symptoms that you had mentioned, what do we do? Just one or?
Call your doctor.
Is having a wet cough for more than 1 month with no fever or shortness of breath or body ache anything to be worried about?
Needs to see a doctor and possibly an X-ray.
Same thing with runny nose and cold weather. Is that an issue?
All needs doctor's advice.
Same thing. Sneezing a lot.
Doctor's advice, guys. Symptoms need doctor's advice. Get your doctor on telly. Talk to them. They will find a path for you. Seek help. When will we seek? This is the time to seek help, advice, guidance. This is it. Early.
If you're setting up a clinical setup in a resident community, what are the essentials that we need to look at?
I'm sorry that I cannot explain to you on this talk right now, but I will like you to call 08049261111, and one of my marketing agents we have everything ready, could help you with it. But this would be a very long question to answer. I'm sorry, my talk did not have this.
Using the N95 mask for a prolonged time gives headache. What mask do you recommend for a long time usage? For a long time.
So I would recommend, yes, you're very right that, even I go through this dizzy headache episodes of wearing an N95. So I close my room and I have a window open and I take it out and do some breathing exercise, re-put it on and go out. So we all have places and outdoors and openings where we can open it, and you should not be, if you're not a healthcare worker or a primary contact or somebody who's taking care of somebody with COVID positive, you actually are not recommended to use N95 mask. It is you who are using it. It's not recommended. So you should be using a triple layer cloth mask, which is tight enough, can be taken out, washed, and reused again and again. Go to a place where there is no one with the window open, take the mask out and breathe. Doctors, healthcare professionals, anybody working, you got to use your N95, you got to use your face shield, but take a break. Go take a break. Go into an open air. Take everything out. Breathe all alone. Don't have anybody around you for 6 feet. And I think that's the way we manage.
Is it safe for children 5 years to go on air, and what precautions to take?
Go on
In
air
for
means
children
flight.
by air mode, meaning travel by planes? And what precautions do you
It
advise?
is the same precaution as adults. There is no difference.
Will LVLG help at this point instead of plasma therapy?
What will help?
LVLG.
IVIG.
I think.
Oh, I'm sorry. Okay.
IVIG. No, it has not shown, there is no data or research that is at this current time suggesting us to use IVIG in any form in replacement to plasma.
Which is the right finger to use for the oximeter because different fingers are giving different readings?
Keep the same finger, but index finger is the best. And remember that this is a very operational, so people get very nervous. So as soon as you will put the pulse oximeter, this is a very important thing that I teach people. Your hands should be relaxed. They should not be cold by washing your hands in water because the blood flow is affected. It should be absolutely normal temperature. You should not have washed your hands recently or anything cold on your hands. Your hands should be in neutral position. You put the pulse oximeter and make sure your chest is open. You should not be sitting hunched forward. Your lung capacity is low. The oxygenation will go. Then sit up straight, erect, have it, and just gently also sort of press it over your finger and press the button to get it on. Just gently, you're holding it from both sides and the numbers will start. And initially it might start low, but it takes a good 1 minute for the pulse oximeter to give you the right reading. And how do you know that? Below those numbers on the pulse oximeter, there is a wave that's coming. If you watch that wave and you see how beautifully it is timed, it is catching your pulse right. If you don't see that beautifully up and down wave on your pulse oximeter, you've not caught your pulse properly. So remember, you would not have touched an icy wine glass or something cold with that hand and using that finger. Circulation is less than. So your temperature of your hand should be normal. You should be straight up. You should be breathing normally, deeply, and hold it on for 1 minute and see that wave. Is it very regular? That is the right oxygen level.
Can we start chemotherapy right now? Is it possible at this time?
Chemotherapy. Now again, I've been out for. I will not be able to give you the right answer. I'm not confident about that. But yes, they are essential treatments, and in cases of essential treatments, I think all medical services are doing what is needed to be done for essential. If it is non-essential, your doctors will still wait, and your oncologist will have the best answer. Sorry.
My wife has MRSA. Is she more at risk for contracting a severe form of COVID-19?
What does she have?
MRSA.
Oh, okay. It's an infection, methicillin-resistant Staph aureus. We don't call them immune compromised. So no, I don't think until and unless her white cell count or her neutrophil count or her lymphocyte count is affected by all of that. But having any infection in your body does make you a little weaker. So I would say that, I don't know how intense it is or how, so just hearing somebody has MRSA doesn't give me an answer. What stage they are, what kind of an infection it is it just prevalent in their body but their blood cells are all fine? It keeps you, a risk stratification has to be done. Not a very clear data that I have here.
One of the methods we came across was the pre-screening method using the chest X-ray scanning, the DICOM interface, and using artificial intelligence program to detect possible COVID-19 positive, having known patterns in the respiratory infections. It would be great if you could throw some light on this.
Yeah, I can say that these were being utilized, but and have shown promise. But if you ask me that are they being used as guidelines or criteria, the answer, according to ICMR, is no. Yes, there have been many imaging and through AI techniques, without any respiratory symptoms, presence of COVID infecting epithelial cells in the lung being found would be a good way. But just like things that have not really or might not be able to be accessible to a larger group in a pandemic situation, this also requires, it is limited to a certain availability and limited to a certain group of people with COVID positive. So not in the common, utilized in the common.
Can the supplements be taken at any time? Is there a before food,
Yes.
after food, any specifications?
Yes, please take them after food. Supplements should be taken after food.
I think that's pretty much most of them.
Okay.
They're all sort of similar. A lot of compliments to your presentation, Dr. Chhavi.
Thank you very much. I'm just in gratitude for everybody to let me be able to share what I have an understanding of COVID at this time with all of you, and to be there on this side to be able to keep you in your homes healthy, and to really be able to prevent a lot of you and your loved ones to ever requiring any critical care. RxDx is with me, and I am with them in helping you through this. Thank you very much.
Dr. Chhavi, sorry, couple of quick questions they wanted. Do we need to keep an oxygen concentrator in the house?
I was very surprised this question wasn't asked. Nobody says no. Can help. Look at the comorbidities, I'll say, look at the comorbidities, the control of comorbidities, age of people around you in your house. If you are two healthy, physically fit people, I mean, I don't think there's a need for it. But if you have people much older with multiple comorbidities and unstable comorbidities, yeah, sure, why not?
And people on blood thinners, are they more at risk? Do they have to be very careful about anything?
No such data. Sorry, not at all.
Okay. Great. Thank you very much, Dr. Chhavi.
Thank you very much for
very informative.
taking me through it. Yeah.
And thank you everyone for joining
Have
this.
a good Sunday and stay safe and stay healthy.
Thank you everyone. Have a nice day. Wear your masks, please, and keep social distancing.